Okay, so good morning, everyone. Thank you, AIOC and my mentor, Dr. Manav Jyoti Burman, sir, for giving me this opportunity to present in front of such an esteemed panel of judges. Without taking further of time, I'd like to present my case. We are presenting a case of macular crisis with detachment associated with juvenile open-angle glaucoma, titled as macular or optic nerve. We present a case of a 13-year male presented to us with chief complaints of diminution of vision in both eyes for past 1 month, which was gradual and progressive to the present state and was painless in nature. He was diagnosed as open-angle glaucoma elsewhere and was started on anti-glaucoma medication 15 days back. There was no similar previous history of any eye problem or any surgeries or trauma. There was no other systemic abnormality. His family history consists of acquired blind eye in the grandmother, and his elder brother also presented with similar complaints. On examination, his best corrected visual acuity of the right eye was 3 meter finger counting and left eye was 1 meter finger counting. His intraocular pressure was 30 mmHg and 26 mmHg of right and left eye respectively. Color vision was normal. Anterior segment was normal with deep anterior chamber and round and regular and reactive pupil. Gonioscoping revealing open-angle glaucoma in both eyes, showing scleral spur in both eyes. Pachymetry was 539 micron and 536 micron respectively. On posterior segment examination, it shows both eye had a pale disc with well-defined margins, with near total coupling and diffuse nerve fiber layer defect, showing a dull foveal defect with showing the extent of the striatic cavity as seen in this figure. On investigation, Humphrey 10/2 visual field analysis for both eye revealed an absolute scotoma. On fluorescent angiography demonstrating cavity of the retinal striatum with absence of leakage. ERG revealing flat scotopic, reduced rod and cone response, and normal cone response. On STOCT, showing striatum in the superficial neural retina and multiple cystic-like spaces within the perifoveal region associated with foveal neurosensory detachment. Genetic testing was done, but no specific gene involved was found. This is the figure showing the Humphrey's 10/2 visual field showing absolute scotoma in the both eyes, and the OCT picture showing striatum in the superficial neural retina and multiple cystic-like spaces within the perifoveal region associated with foveal neurosensory detachment. This is the ERG revealing a flat scotopic and a reduced rod and cone response. The fluorescent angiography demonstrating cavity of the retinal striatum with absence of the leakage. He was diagnosed as macular striatum with detachment associated with juvenile open-angle glaucoma and was put on maximum anti-glaucoma therapy. Filtration surgery was planned as and when required, and it was advised to follow up after 3 months. Thank you. I've concluded with my basic